So I'm John Snelling. I'm Associate Director for Primary and Community Care for Manx Care.
So, is Strep A a concern?
Strep A is always a concern, particularly in the winter months. Streptococcus are bacteria which get in everybody's throats and up their noses, and we see it winter by winter. It's actually here all year round. There has been quite a increased incidence both in the UK and in the north of Ireland in recent days, and so you'll often get clusters like this. We have one right now.
So is there evidence of a cluster on the Isle of Man?
We've seen an increased number of cases in the north of the island in the last week or two, yes.
And what should people be on the lookout for? Does it affect mostly a certain type of person?
It affects children, but actually it can affect anybody. It tends to affect children a little bit quicker, I guess. That would be the thing. But then that's the case with any upper respiratory illness, really, in a child. They tend to get quickly ill and quickly better, which is the good news. Yes, the symptoms are very similar in many ways to most upper respiratory illnesses. You get a sore throat, you get a headache, you can get runny eyes and runny nose, and you get a fever. As I say, that's in common with many other things. The thing about streptococci, particularly when they have serious infection, is that you'll get the scarlet fever rash as well, and that's a sort of red pinky rash which feels a bit like sandpaper on your skin, and that's what we're asking parents to look out for with their children. 12 to 24, 48 hours later is the typical period after the onset of symptoms.
And scarlet fever is something that public health have written to schools. Is that something specifically affecting the island?
The island? No, it's happened in the UK as well. We've had scarlet fever here every year. It happens, it's a common illness actually. The point I think, and the reason why it's got into the news recently, is there have been some quite serious outcomes from scarlet fever in a few cases. It remains rare that a child or an adult will get very unwell from scarlet fever. Most of the time you get a nasty rash and you get a headache and you feel pretty grotty for a day or two and you get better. Just in a few cases it can make you very unwell, and we're very keen, obviously, to catch those cases early and to make sure they get the antibiotics they need.
So in the UK, we know that there's a shortage on antibiotics maybe, and there are distribution issues. What are the supplies like over here?
Well, this is a fastly evolving situation, and I suspect it's going to change week by week. The various appropriate health departments are working together to make sure that the supply and distribution of antibiotics is there and is appropriate and changes according to the situation. And we will certainly update you regularly to make sure that the public are aware if there are any dangers of problems with distribution or supply in the future. Currently, I'm not aware of any.
Okay, let's talk wait times at GPs, and we've heard this week that 48 missed appointments happen daily across the 11 GP practices, and also people have long wait times. Your colleague Paul just then said that the hospital is likely to see increased demand over the winter period. What's that going to be like for the GPs?
Wintertime is always a pressure time for the whole of the healthcare service, and that's really just because people get iller with minor upper respiratory infections, and of course if they have long ongoing lung and heart conditions, for example, they will tend to find that those conditions will get worse during the winter because of a concurrently running viral infection. So it's a busy time for us all. For GPs it means the demand on appointments is greater. What we're trying to encourage folks to do is, well, firstly, as you mentioned a little earlier on, try not to miss your appointment, because obviously every missed appointment means that the person who next needs to see the GP is going to have to wait longer for that. It's a frustrating position to be in, to have nearly 50 appointments across the island per day missed by patients who forget to ring and cancel those appointments. My appeal would be, if you can't make an appointment, and we fully understand that there are good reasons for that from time to time, please let us know. It takes a couple of seconds of your time, and it could save someone else from being really poorly and being frustrated that they can't get to see their doctor.
And where can people go if they can't get access to a GP quickly?
Yeah, that's a really good question. There are lots of alternatives. That's the important thing to say, is your GP is one of several alternatives when you have a minor illness. We have a group of really experienced and specifically trained pharmacists across the island now in the community pharmacies who can see you and will be able to both diagnose and treat you in a sort of one-stop shop, really. Often quicker than if you waited to see your GP, certainly quicker than if you sat in ED for many hours. So pharmacist is one option. Your optician, if you have an eye problem, there is now a particularly specialist service in the Specsavers branch in Strand Street in Douglas, where any minor eye condition, not just for your eyesight and glasses, but any minor eye illness can be dealt with again on the spot there. So that's another alternative. The community dental service and the community mental health service are both also alternatives to your GP.